Shaquina Missick.
I'm Tomberlin, and we have an assignment for professional nursing to do a paper that is a challenge for nurses, and we decided to do the nursing shortage, contributing factors, and possible solutions.
Now, for our outside viewers, this video will not be private. It will be a public video, so we know that this may or may not be an interesting topic for you, but we will include some bloopers at the end that we would like you to stay tuned for. So we'll get started.
Grab some popcorn.
Grab a soda.
Or the vegetarian water for the
if
people.
If you're, health guru, workout freak. I stopped paying for my gym membership a long time ago.
So nursing shortage. What does that mean? Nursing shortage is coming from a variety of aspects. We're going to just focus on a couple of them. Mm-hmm. Mainly, the ones we're going to focus on are the increasing nurse-to-patient ratio, the increase in number of retired nurses, and the increase in the client population. Okay? So nursing itself is trying to become a well-respected profession. So that already entails some difficulty. You have to go to college. You have to get a licensing, which is a huge test that nursing students, we all know, it's a beast. We're scared for it. But also, we need to be fast-forwarding a little bit to the nurses that are already in the actual workforce. It is very difficult for nurses to balance the workload that they are given each and every day, especially in hospitals. Nurses are given 5, 6 patients to one nurse, and that is a huge amount of responsibility and a huge workload when maybe 3 or 4 of them have a chronic disease. They're not even in there for a fall or a broken leg. They're in there for untreated hypertension or something. So that makes it hard, and this quote is very interesting because the Bureau of Labor Statistics employment projections for 2010 to 2020 says that they expect 500,000 chairs to be open for nurses to replace. So that's just to put people in a nursing position.
And that is an astounding number given that it is already 2013. So
not only do we need more nurses because of just a bureau statistic, but because of the because of the patient increase. When a patient has a chronic disease, they're coming to the doctor more often, they're coming to the hospital more often. So because of the technological advancements and the pharmacological advancements, people are starting to live longer, which is wonderful. But it's starting to take a burden on nurses because once people start to ignore their signs and symptoms of a disease, start to ignore the doctor, they don't need the doctor, they don't have money for the doctor, it starts to compile into this huge thing. And more patients are being seen that have metabolic syndrome, which is something that is very complex and is brought on by obesity and age, where you have the center obesity, where it has the apple shape, you have the adipose tissue in the abdominal area, and it can lead to problems such as diabetes type 2. You can develop heart disease, and you can even develop kidney disease, or all 3 of them, because it's so severe. According to the AARP, there are more and more patients seeing a disconnect between themselves and a healthcare provider. They're seeing unnecessary rehospitalizations. They're having difficulty going from their hospital settings to their home settings, and they're seeing repeated tests, and they think they're unnecessary, so they ignore their doctors, they stop going, and that ends up costing more because they have to go to the hospital for not only one thing now that they were trying to prevent, but multiple things that could now be bubbling up into what metabolic syndrome, cancer, multiple things.
Of course, as professional nurses and future nurses, we can't necessarily put these issues on the back burner, although we'd like to. So we have to start making some changes now, as Aaron was saying, just fast forwarding a little bit, so that we don't have so that this issue doesn't necessarily blow up in our face when that time around 2020 actually rolls around. Many colleges have been receiving funding and grants in order to facilitate larger programs to increase the output of nurses, and that actually comes from a wonderful peer-reviewed journal entitled Implications for Reward and Recognition of Academic Staff in Schools of Nursing and Beyond. Okay, to further help with the shortage of nurses, it's possible that raising the retirement age or the number of years that a nurse must work in order to retire could actually be increased. We do know that that particular intervention will probably be rejected most definitely by the nurses that are currently in the workforce, but the huge gap that's approaching has to be considered. However, if a huge gap exists, retirement funds that are available are one of the areas that's going to be heavily impacted by the shortage. So professional nurses and nursing students can also become more heavily involved in their own respective communities. This includes things like informational sessions, blood drives, blood pressure screenings, which we have all participated in this semester. It not only gets your face out there as an organization and as a profession, but this encourages people to take better care of themselves. If people can take better care of themselves at home, they're less likely to make it to the healthcare facilities once their conditions or illnesses have become life-threatening. Life-threatening diseases cost more money. They require more frequent visits to the doctor. The barrier to this intervention will possibly simply just be a lack of time. As the professional nurses, Aaron mentioned their enormous workloads, having on average 5 to 6 patients per nurse. And as we are all aware, as nursing students, the course loads are
tremendous,
out of this world, and it can just be difficult to go out and find the time to encourage and help other people become aware of themselves, especially when you know that this intervention may not necessarily provide immediate results. So
people often, as we noticed at the blood drive, were personally accountable when we came up to them and said, hey, do you want your blood pressure taken? When their blood pressure was sky high, that made them think, well, I haven't been to the doctor in 3 years. So just putting it in their face, saying, hey, you can be at risk for some serious diseases if you don't keep this in check, that makes them personally accountable. So it gets them to the doctor, less risk of chronic disease, less risk of death.
Absolutely. As nurses, we all need to vow to provide the best quality care that we possibly can, and this begins with taking care of ourselves. If we're not adequate and efficient, we can't possibly provide the care that it takes to save a life. And if we're on our P's and Q's, that'll most definitely contribute to a quicker recovery for our patients. And we also need to make it a priority to be mindful of the materials and the resources that are available in our healthcare facility. And this doesn't mean withholding items that are needed, but when it comes to methods of practice and hospital protocols, that can definitely be a barrier. Where I may have learned to use 2 Band-Aids on a wound, and may have learned to use 15 packs of gauze and 20 packs of tape. So it's something to be considered, because those resources equal money, which could provide a whole nother salary for a nurse at the end of the day. So we need to implement strategies to lessen the current strain and the strain that is definitely coming with this nursing shortage. Although some say that we have taken a stray turn from the foundation set forth by our beloved Florence Nightingale. We will always and have always been the patient educators, the patient advocates, the interpreters, and just the caregivers on the front line in a healthcare facility. And that's going to contribute to the future autonomy that we are striving for. A decrease in nurses, the accessibility of materials, and an increase in patients and their age is just going to make it extremely difficult for us. Therefore, on all ends of the spectrum, the professional nurses now, the students coming up, the colleges and universities, the pharmaceutical companies, people outside of nursing in the healthcare facilities should all work together to
battle this nursing shortage.
Absolutely.
It is a huge issue that not only one thing will solve. Thank you for listening.
Thank you. It's for you, Dyke. That's for you. Is it recording? Okay.
Oh, okay. That's a
So,
good one.
when Erin stopped turning red and I stopped sweating under my armpits, or under my auxiliary.
So, I don't want to start there.
I'm so serious. Where's he going?
I don't know. I was feeling that was a train finna head to the wrong direction.
Blood drives, blood pressure screenings, which we all have been. Okay.
More and more patients now are starting to see a disconnect with physicians. Don't sneeze. Don't sneeze, girl. You made me lose it. According to the AP difficulty transiting.
Sorry.
Sound like some electrical current. Transiting.
Sorry.
All right.
So if they can just be aware of their, that's exactly what I just said. So I'm not even going to go there.
Okay, you finish.
Okay.